it's Tina Algrace here, and we are here with our partners at Sydney Voice and Swallowing. We're going to be discussing voice anatomy and voice function with Associate Professor Dr. Novakovic and ENT Specialist with Dr. Thomas Stewart. Thank you very much for having us today.
Thank you for coming in, Tina. It's our pleasure to speak to you.
Yes, I'm very excited. We basically have a series of questions that our students have asked and people want to know about. So the first question I'd like to ask both of you is if you can just give us a rundown of what an ENT specialist is and what they specialise in.
So an ENT specialist is an ear, nose and throat specialist. So we're doctors and we look after problems that people have with their ear, nose or throat. And also we deal with other things that happen in the head and neck, for example growths and tumours. So anywhere from your nose to your throat and the upper airways, that's what we're involved in.
Oh, wonderful. So it's probably a good idea that singers come and see you every now and then.
Yeah. So we are not just ENT specialists, but both of us have finished our ENT training in Australia.
Wow.
And then after that, we've both gone overseas to do international training in the area of voice disorders and laryngology. And laryngology is the field of medicine that looks after the larynx or the voice box. And so they're problems that might occur that singers might get, or any people with voice problems may get, or swallowing problems, or even breathing problems that can affect the throat. So we look after all those problems. We also take care of the professional voice.
That's amazing. That's awesome, actually. Okay, so the next question is, when and perhaps why is it important for a vocalist to make an appointment to see an ENT specialist?
So I think there's two major reasons why you might want to come and see an ENT specialist or even a laryngologist. And the first is for a healthy voice check. So for singers that use their instrument, their vocals as an instrument, it's often useful to have a baseline of what your larynx and your vocal cords look like when you're healthy. And that way, if there ever is a problem, we know where you started and we know what you look like at your best. Okay, so we've got a baseline to refer to because there's all sorts of different issues that can occur, and everyone's got a different looking voice box and different looking vocal cords. The other reason, and this is probably more common to see us, is if you're running into trouble with your throat or your voice, or any of the ENT systems, ear, nose or throat, that might be affecting your voice, even something like sinusitis or postnasal drip. All of that stuff can affect your voice and your ability to speak and sing as a vocalist or any type of professional voice user.
Oh wow, okay. Well, tagging on top of that, what are some of the common vocal conditions that a vocalist may come in with? Can you enlighten us on some of that?
I think that the biggest complaints are a change in the voice. And we were just thinking about this morning, when would you get someone to come in? Really a change in the voice that is there for more than 2 or 3 weeks.
Yep.
Especially if it's not improving with rest. So a change in the quality of the voice or the ability to produce voice. I think then it's important to come and see a specialist in ENT to see if we can get a diagnosis and make sure there's nothing serious going on. Obviously, if you're sick or have laryngitis or you've had a big night out and you've been yelling and your voice is a bit rough the next day, you shouldn't rush in to see the ENT specialist. Then you need to do things like rest and look after your voice. But if things are not improving within, say, a few weeks' time, you might want to think about getting a referral to see one of us. What the other things we're saying? Maybe...
Well, also features whereby you might, for example, have a sudden abrupt change in your voice, particularly on phonating, for example, on singing. There's a sudden change that can represent something that's acutely changed and can necessitate a look. Also, if there's pain, if you're an experienced singer and something has changed and you're feeling pain on singing or phonating, that can be a concern.
And that is a long-term thing, more than a couple of days. That's like a week or a couple of months.
And a really good test.
Yes.
That is to work out whether a period of voice rest changes or improves or resolves the symptom. So for example, if you have a symptom that develops and you've had a significant vocal load in singing, and then you institute a day or 2 or a weekend of voice rest and you notice a significant improvement, it likely is that there's not much significant going on there. If it's a recurrent feature, you may still want to get that looked at, but in terms of an alarm symptom, what would be more alarming is if the pain is persistent, just doesn't go away. And I like to think of vocal rest as essentially almost like a prescription. It's like the first medicine that can be provided, and so that's often the very first thing that we suggest to the patient with a problem. So have you tried some vocal rest, proper vocal rest?
And this is one of the issues, is that sometimes people don't have a good internal understanding of their limits and how much their vocal cords can take, because we're all different. Some people can run marathons and their knees are fine. Some people like me can run 100 metres and they're not so good. So, and it's the same with the voice and the vocal cords, and sometimes we don't know we're overloading it. And if it's not reversing with rest, that's a problem, because then we may have done some damage then. Yeah. But we also get referrals from students or singers that have come by their singing teachers. And this is quite common, where their singing teachers will say, well, hang on, you're not able to hit this note, or there's something wrong with your transition from your upper to lower upper register. Look, there might be something there. And often the singing teacher has a little bit more experience, understands the vocal instrument, and has experience with other students, and they might hear that there's something not quite right and say, look, maybe you should get this checked out and make sure there's nothing structural going on.
Yeah, that's right. Usually there's a lack of phonation at some point in the scale, and it keeps happening at that same spot.
Exactly. And so sometimes we'll look down and say, look, you're all clear, the instrument looks great, it's just the way you're playing it, keep working with your teacher. But sometimes we might look down and say, look, we've got a problem here, it's a medical issue, we need to look at what you're doing. You might need to change the technique, or we might need to get you to see a speech therapist to do a bit of work there.
Oh, wonderful. I guess the next question is for singers, how often should they think about visiting an ENT, even if it's just for a normal healthy vocal check? What's the timeline usually?
I think you don't have to see an ENT. It's not critical. I think if you're having a healthy voice check, one good examination with someone who knows what they're doing is useful.
Okay.
We would recommend that it's always useful to have a video of that examination as a baseline, because you might be touring or going elsewhere, or you might see another doctor. So to have a video on a USB disc of your voice when it's healthy is useful.
Yes.
From then on, if you're not having problems, you don't need to see us.
Yes. Absolutely.
But if you do start having issues, or you're worried, or something changes, that's when we need to see you, or when we recommend we'd see you. We don't want you to leave it for 6 months and say, well, I've been struggling, my voice doesn't sound right, I can't sing anymore. How long's it been there for? A year. That's not good, because after a year you might have already done some damage. So we'd rather see you sooner, within sort of weeks to months, rather than waiting a long time.
Yeah, so I guess in this case it's very much it's student driven, student responsibility, vocal responsibility. Anyone that does maybe copious amounts of talking, they need to be aware of their own voice and almost just be monitoring how they usually sound versus any changes that may occur.
They can monitor themselves. They can ask other people can monitor them. So often, if you don't have an awareness of your voice, and this is not so much singers, but often if you don't have, other people might say, what's wrong with your voice? Or your singing teacher might say, look, something's changed in your technique. And then you might say, well, let's go and see what's going on. But it's not just a change in sound. Also, you might have increased vocal fatigue. You might have less stamina. You may have increased effort to produce the same notes, and all those sort of things can be a sign that something's not working optimally.
Right. Is voice loss something to be worried about? I know that some students and people that I know sometimes say, I've lost my voice, I can't talk. Is that more of a viral thing? Can you elaborate a bit more on that?
Yeah, so the most common cause of voice loss in the community is by far viral laryngitis.
Right.
Now, not all voice loss is laryngitis. Often people come and say, I've had laryngitis for a month. You don't get laryngitis for a month. Okay, laryngitis lasts for 4 or 5 days. It's a virus infection like a flu or a cold, and the vocal cords get inflamed, and the best thing to do there is to rest them. If you keep singing and talking when you've lost your voice when you're sick, you're going to do some damage.
Correct.
Okay, so we back right off, we rest, we do all the vocal hygiene things, which we'll speak about a bit later, and that should return within 4 or 5 days. Now, if after a week the voice is not coming back to 80-90% of normal, or if it persists for more than a week or 2, then we've got an issue. But it's not uncommon to temporarily lose the voice with a viral infection. Now, if you're singing and you lose the voice suddenly during singing, that's a bigger problem.
Right.
Okay, that probably represents something like a hemorrhage or an acute strain.
Right.
And that needs different treatment. So we always ask people about, when did the voice change, what were you doing? Now, if you were sick and it happened then, that's not a problem. But if you were singing and it pops, that's a blood vessel popping. And that probably needs a look at some stage, especially if it happens more than once.
Alright guys, I hope you enjoyed episode 2 of the Voice series. Thank you to Sydney Voice and Swallowing once again for donating their time and their knowledge for our students and rising stars. If you missed episode 1, you can click here for finding out what an aerodynamic assessment is, or you can watch episode 2, which will be coming out next week, or if it already is next week, you can click on this link over here. We're going to be answering our students' most popular questions, so stay tuned. I hope you're well wherever you are in the world, and I'll see you soon. Rise above and love. Mwah. Bye.